Well, let's talk to Dr John Puntis. He is co-chair of Keep Our NHS Public. He's a retired consultant paediatrician. John, thank you for joining me this afternoon. I think that...
Well, Peter, you're very welcome.
Everybody wants a really good NHS. I think, you know, the UK public is generally pretty committed to universal healthcare, generally pretty committed to the NHS. But the relationship we have is that we like it as an idea, but in practicality, when people have experiences of it, a recent survey said only 29% of people were actually happy with the NHS. What does it need? Does it need reform on money? I mean, it's been given a lot of money over the last few years, as I just mentioned there, John. But what is the answer here?
Well, it needs both, I think. But I mean, reform's a bit of an empty word. One way to define it is useful improvement. And of course, the NHS is reforming all the time. And that's why, you know, we now have a modern health service as opposed to what we had in 1948. And I think it does need more money, and that's because the population has grown, the numbers of people with chronic illness has grown, we have an ageing population, inflation, of course, eats into the settlements for the NHS. So if you actually look at the amount of spend in relation to units of healthcare, the numbers have actually gone down rather than gone up. So the nominal spend has gone up, which is why politicians say the NHS has got more money than ever before. But that's meaningless unless you look at the increase in demand, and then funding's actually gone down.
And tell us about that demand, because there'll be a lot of people who will say, look, there's been a huge amount of immigration to this country over the last 14, 15, 20 years, depending how you look at it. We also know that there's an ageing population. We also know that there are drugs out there that are being developed that are more expensive. Are there other elements to this as well?
I don't think immigration's really got anything to do with it.
Why not? If you've more people, surely there's a greater strain on the NHS. I mean, that's just numbers.
Well, immigrants come and work in the NHS and contribute to society and pay.
They absolutely do, John. I'm not disputing that at all. I've been treated by many doctors and nurses myself who have come here from other countries. I'm not making an anti-immigration point. I'm simply saying if there are more people in this country, well, then there will be pressure on the NHS. We know, and it is factual that the population, the numbers have increased.
Yes, I agree. So if the population grows, then you need to spend more on healthcare, but you also have more people paying taxes to fund that. So I think the expectation that somehow you wouldn't have to spend more money on the NHS is a nonsense. And of course, there are various pressures, one being population, one being aging, but also, you know, a huge increase in mental health problems and a huge increase in chronic ill health problems such as diabetes and obesity, of course.
Is it reasonable? I'm not saying, I mean, I very much am in favour of universal healthcare free at the point of use, paid for by taxation. But there are other systems around the world that have social insurance, that do it in a private way, that do it in other ways. I mean, should we start looking at them and thinking, hold on a second, can we do this better?
There still are international comparisons of health services in the richest country in the world, in the 10 richest countries, and they compare with the USA, the Commonwealth Fund. This is a very robust benchmarking of the NHS. And until just a few years ago, the NHS used to come out the top. So I think the NHS model has been proved to be a very good one. And as Lord Darzi pointed out in his recent report, all other models that involve social insurance or private insurance, they're all more expensive. So he actually warned the government away from thinking in terms of a change of model.
Why hasn't the NHS been top in recent years? What have been the factors that have been involved with that?
Well, the Commonwealth Fund, the reason why the NHS fell to fourth, although I think it's gone back to third now, is difficult accessing services. And also the Commonwealth Fund identified a lack of investment in healthcare as being another factor.
OK, John, thank you very much indeed. That's Dr John Puntis there, who is co-chair of Keep Our NHS Public. He's a retired consultant paediatrician.